To discuss vaccines and their approvals, I'm joined this morning by Health Canada's Chief Medical Advisor, Dr. Supriya Sharma in Ottawa. Nice to see you, Doctor.
Hi, Rosemary. Nice to be here.
Thank you for making the time. I want to talk about Johnson & Johnson first, if I can, just because it was approved in the United States, and I know you were waiting on some final data from that company. Can you tell me if you've received it and what your expectation is for approval with Johnson & Johnson?
Yeah, so for Johnson & Johnson, we were waiting on some manufacturing data, and that came in yesterday. So we're starting to look at that. It's really difficult to predict exactly when we might make a final decision because it really depends on that data. But we're looking at in the next couple of weeks.
And does the FDA, the fact that the FDA approved it, does that facilitate your approval in any way?
Well, certainly with all the vaccines, we're working cooperatively with our international regulatory partners. We're sharing information. In terms of the committee meeting that the FDA had, we had observers there as well. Okay. So all of that helps make for a more efficient review.
The fact that Johnson & Johnson is, well, at least for now, one shot, I know there's the possibility that it becomes two shot, but for now it's a one shot vaccine. How much of a game changer do you think that could be for this country?
Well, I think with respect to all the vaccines, what we're seeing in the clinical trials is that they're all very effective in protecting us against what matters most. So that's severe disease, hospitalizations, and potentially death. Obviously, if a vaccine is only one dose, then that makes it easier for administration. You don't have to do the follow-up to, record people and track them down to get them the second dose. So all of that helps, but what really helps the most is getting as many vaccines, authorized and get that supply in as quickly as possible.
Can we talk about efficacy a little bit? Because I do think perhaps the media are doing you a disservice when we talk about the different percentages of efficacy of vaccines. So can you just explain to Canadians what you're looking for when you approve a vaccine and whether or not that efficacy percentage point is helpful in considering at all?
Sure, and you know what, you're absolutely right. I think we're starting to see a little bit of a narrative of good vaccines and bad vaccines. There really isn't that sort of that delineation. So what we look at for efficacy, so efficacy is, something does what it's supposed to do. And for COVID-19, what we do is that you have a group of people who get the vaccine, another group of people who don't get the vaccine, and you compare numbers of cases in both of those groups. And so the 66% or the 94% comes from total numbers of people who have COVID-19 with symptoms versus, one group versus the other. Now, when we look across all the vaccines, the major 5 that are under review and authorized, if you look at that subsection, as we said, that matters most, so severe disease, hospitalizations, dying of COVID-19, all of these vaccines are equally protective. And the other thing is that a couple of things. One is that you can't really compare one vaccine to another unless you have what we call head-to-head trials. Mm-hmm. So you've got 2 vaccines in the same trial at the same time. If you look at when the Pfizer and Moderna vaccine trials were done, that was back mostly in the summer. We were in a very different place in terms of variants of concern at that point in time. And so the AstraZeneca and the Janssen trials were done later when we did have variants of concern, and they were showing that they were equally as protective for those things, like we said, that matter most.
Mm-hmm. Okay, that's really helpful. Thank you for saying that. So what would you say then to some Canadians who, I'm sure you've heard it, I've heard it amongst my own circle, I'm going to wait to get, X vaccine because I'm not sure about this vaccine. What do you say to those Canadians who are thinking about shopping around a bit?
Yeah, so I would say the best vaccine for an individual is one that you can get. I mean, that's pretty simple. It's not, the longer you wait to get vaccinated, the more time that goes by that you're not protected. And so for people who are sitting back and waiting for another vaccine, I would say the longer and the more people do that, the more we're all going to be sitting at home, if we're lucky enough to have a home, waiting for us to get control over the numbers of cases. So while we still have, thousands of cases of COVID-19 circulating, it's important as many people get vaccinated as possible. We get those numbers down. It's not really about you or me or an individual. It's about what we can do as a community to get the numbers down. That will help all of us in terms of decreasing the number of illnesses, the burden on the healthcare system. It even helps in terms of the number of variants. And the quicker we can do that, the quicker we can get back to some sense of normality.
I know it is ultimately up to the National Advisory Committee on Immunization, but could you foresee their recommendation for vaccines being given to certain parts of the population? For instance, the same way the government decided that Moderna, because it was easier to ship, it was going to go primarily to remote communities and the territory. Is it possible that NACI decide that one vaccine should be for one part of the population and another for another part of the population?
Right. So what NACI does is that it looks at, so when we do the authorization at Health Canada, we're looking at one vaccine, safety, efficacy, quality, benefits outweighing the risk. NACI takes that information, puts it in context with the other vaccines that are authorized and are available, and does exactly what you've said. Mm-hmm. It provides advice to the provinces and territories about what populations might be best served by that vaccine. Then, of course, the provinces have to take a look at their own epidemiology, their own pandemic, their own demographics, and then take that advice from there. But definitely within the next few days, we expect NACI to be providing some recommendations.
Can I ask you a little bit about the variants of concern? I'm wondering whether you've looked at or received any modifications of the mRNA vaccines, Pfizer and Moderna, to respond to those variants of concern, because I know they're quickly adapting. Have you received any updated data around those points?
So there's two sort of buckets of data that we'll be getting. One is that as part of the licensing and the authorizations of all the vaccines, one of the commitments the companies have made is that they will continue to provide us information on the testing of their vaccines against the variant. So that's one part of it. And we are getting some data. I think in general we're seeing that vaccines are more effective against the B117 variant, which is the one from UK, more so than the one in South Africa, which is the B1351. So that's one pool of data. The other pool of data would really be around, what we're calling sort of the redesign of the use of the vaccines. And so we haven't received data there, but we do know that companies are working at potentially making modifications to their vaccines, and they're thinking about whether or not different boosters might be necessary. So, no regulator has really received a submission for a redesigned vaccine or a new schedule, but we're all working together to make sure that the requirements aligned, and when we get that information, that we're ready to review that as quickly as possible.
Can you just give Canadians a sense of the speed at which you are working compared to what you would be doing in normal times? Because I didn't know you before, because this was not necessary for us to have these kinds of interviews and exchanges, but you are working at an extraordinary pace here. That's fair to say.
Yeah, as the regulator, we're happy to be in the background. I think people don't necessarily think about the regulatory review process, but, they're touched by it anytime they take any medication, there's any medical device that's used. But we kind of, continue along in the background. Obviously, COVID-19 and the vaccines have brought that to the forefront. I think really simply put, we have not taken our foot off the gas for a second. People are working 7 days a week. We've got dedicated teams, each working on vaccines. We were just talking about Janssen information. It came in yesterday on a Saturday. People are working on that, all day last night. Every time we come down to an authorization, as soon as it's done, that's when we're out and we're communicating. So most of the times, people are working overnight the night before to finalize everything, to make sure all the documents are up on the website. So it has been nonstop now for all of the teams. And, I get to stand, sit with you here and talk about it. But it's really a privilege to be here talking about the excellent work of the tens and hundreds of people that are behind all of these reviews. So I think Canadians just should know that we have not stopped. We are working flat out, and we will continue to do so.
Good. Well, I'm glad you got to give your team a little kudos there, Dr. Sharma. Well deserved. And thank you. I always appreciate your expertise. You help me understand a lot. So thank you for getting up on a Sunday morning for us. Appreciate it very much.
Well, thank you for your interest.